officials are ringing the alarm bell over new cases of bird flu in livestock. Across 9 states, 36 dairy cattle herds have tested positive for H5N1. So far, only 2 cases have been reported in humans. The CDC has set aside $93 million to scale up efforts to monitor those exposed to the virus, collect and test samples, and increase the number of tests available. Well, Dr. William Schaffner joins us now. He's a professor of infectious diseases at Vanderbilt University Medical Center. Dr. Schaffner, always good to get a fact check from you. So tell us just how widespread is this outbreak?
Well, Lana, the outbreak in birds is very widespread. Indeed, it is spreading around the world. It's transmitted by migratory birds who, during their migration, spread it widely. And here we've had many flocks of chickens and such infected. And now, of course, the big surprise is that dairy herds, just as you have said, in 9 states are affected. But so far, this virus has not picked up the capacity to spread to humans and among humans. So far, so good.
All right. So we were talking about those dairy herds. We're seeing it showing up there. People want to know, are milk products safe?
Milk products are safe. This virus, if it gets into the milk, first of all, in infected herds, the milk is being kept out of the commercial supply. But even if it's in the commercial supply, pasteurization will kill this virus. So milk, cheese, yogurt, all those good dairy products continue to be safe. I had milk in my coffee this morning.
I did as well. And then another cup of coffee just before the show. So, Dr. Schaffner, people want to know, though, how potentially dangerous it could be to the human population. Lucky to know that that isn't widespread at the moment. Viewers are also going to want to know from you what the symptoms are.
So, sure. So, could it develop into a new pandemic virus that could spread around the world and cause a lot of illness? This bird flu virus and its predecessors have been around for 10 to 20 years, and it has not yet picked up that capacity. If it did, then Katie, bar the door, we would be dealing with another pandemic. And then the illness it would cause would be very similar to our conventional influenza that we get: sore throat, stuffy nose, deep cough, a tendency to pneumonia, and in frail older people causing very serious illness that could lead to death, of course. But that hasn't happened yet. So we're anticipating that that might happen. So we've created vaccines already. They're blueprints that are ready to go in the event this virus suddenly develops the capacity to spread among humans.
Good to know that preparations are underway, but that we don't need to be that worried about it at this point. Dr. William Schaffner, thank you for all that you do.
Right. Thank you.